Hi, everyone. Nice to be here. My name is Ian Cummins. I'm the director of the OHT Strategy and Performance team, and we're really happy to be here to share the work that we're doing as it comes to equity measurement and data. I just wanted to take a step back. OHTs were introduced back in 2019, and for the first few years, OHTs were asked to identify their own local indicators, and that made sense at the time, given the level of maturity that OHTs were at. But it presented a challenge in that Ontario Health and the Ministry, as the funder of the OHT, really wasn't able to report on progress or measurement because every OHT was using a different set of measures. And so beginning in 2024, we started to transition to and introduce a performance and improvement program that includes a combination of some standardized measures as well as some enabling processes. So we have a set of standardized system level measures, and that's many of them are ones that you've already heard about, like cancer screening or ambulatory sensitive conditions. I do also want to highlight, though, that we are really committed to patient and provider experience measurement. We will be rolling out a provider experience surveys to all OHTs in the coming days. And that survey does include demographic questions that allow us to stratify results by age, gender identity, and ethnic identity, to some of the comments in the chat. Same with our patient experience survey, which we are hoping to roll out a little bit later. In addition, we do have some process measures that are equity focused. We do measure, for example, cultural safety training within OHTs and Indigenous representation on OHT leadership councils. So we have a range of measures that we're looking at, and all types of measures do have an equity focus. In terms of enabling processes, we have begun to roll out quarterly OHT performance reports, and the purpose of those reports is to give OH as the funder an opportunity to review performance with the OHT using a common data set. So I'm gonna talk about what equity data is available in those reports. We do also have a quarterly performance review process similar to many other health service providers, as well as quality improvement planning continuing. This is a summary of our OHT performance reports that we are rolling out to OHTs. They do include a dashboard that talk about how performance is trending across a series of measures, as well as 3 years of historical trend data that include some of the equity data I'm going to talk about. The measures that are included are at the bottom. We are, of course, focused on primary care attachment and Healthcare Connect waitlist clearing, but also continue to have a focus on chronic disease prevention management and cancer screening. These measures were selected in consultation with OHT and clinical representatives and are being reviewed in preparation for next year. If we move to the next slide, I'm just going to provide a quick overview of the equity data that is available through the performance reports. So for each measure, for all of our measures, with the exception of Healthcare Connect, we have included an equity stratification. It's aligned to the same methodology that Walter spoke about previously. But just wanted to highlight that for each measure, you will be able to see how your quintile, how your values are distributed across 5 quintiles, both for the quarter that you're in the current year, and you'll be able to compare it with the quarter in the previous year. And that data from the previous year will give you a chance to see how the distribution of your results are trending over time. So, for example, in the graph that you see on the left-hand side here for ambulatory sensitive conditions, you can see that the number of, hospital visits was greatest in the most marginalized group, the fifth quartile, compared to the fourth quartile, and it does look like it's trending towards greater inequality and greater a less equal distribution compared to the previous year. So with this equity stratification data, we are hoping that OHTs can review it in consultation with their OH regions and really see which measures have the most even distribution across quintiles and where there might be some opportunities to improve performance. And where there is an uneven distribution across quintiles, that can be an indication that there might be some opportunities for some targeted interventions. So I will note that equity stratifications are only possible where we have sufficient amount of data for some of our measures like CHF and COPD admissions, where there's a lower number of results. We may not have values for all five quintiles, or may have such a low number of values that quintiles need to be suppressed for privacy reasons. And so we are providing the equity stratification where possible for all measures. In addition, beginning with the Q2 performance report, we will provide SII values both for the current year quarter or in our annual report for your full year. And we also will provide the values for the previous year so you can compare results. Again, in the previous presentation, there was already discussion about what a negative SII or a positive SIA means. Of course, what you're aiming for is an SIA closer to zero, which indicates that you have a equal result. We do have some limitations in providing SII where there are missing quintiles or for smaller OHTs. And so for that reason, in the Q2 report, SII values will only be included for those measures where we have all five quintiles present, and for OHTs with an attributed population of 200,000 or more. Those parameters will be reviewed over time, and if we can calculate SII values for more OHTs and more measures, we will do so.